So, good day, class. This would be the first lesson of your Clinical Chemistry 2, which is your enzymes or enzymology. So, enzymes, class, is a very big factor in your Clinical Chemistry 2. It's one of the most interesting topics, and it is usually encountered in almost all board subjects related to medical technology in hematology, immunology, serology, immunohematology, and other subjects. So, with that, let's start your lesson 1 enzymes. Now, enzymes class are technically what we call biological catalysts. Now, whenever we would hear the word catalyst, please take note that catalysts are or enzymes are basically one substances that would enhance or speed up a reaction. Meaning, class, they would allow reactions to finish at an earlier possible time. So in the definition here, it hastens chemical reaction without altering the equilibrium point of the reaction or being consumed or changed in composition. So basically, class, enzymes do not alter the substance that they would act on. That's why it's a very important part in our body. It's not able to change anything. It just allows reactions to finish faster. Now, enzymes are particularly involved in chemical reactions happening in our body. Now, enzymes class are always measured in terms of their activity. So, unlike other substances, diba, in other substances, the higher the amount, the greater the effect. But in the case of enzymes, what you're measuring in enzymes class is their activity. So the stronger their activity is, the greater the activity, the more effective enzymes are. So we are not measuring their absolute value class, but their activity in the body. For example, class SGPT with the measurement of 50 units per liter. So the 50 units per liter here, class, is not the total level of SGPT in the body. So take note, class, whenever you would encounter the numerical result of enzymes, we're not talking here the value or the amount or the total level, but instead we are talking here about the activity of the enzyme. So as I mentioned, the more activity, the more it's effective, the more it's present in our body. Now they would appear in serum after cellular injury. Now whenever you would hear cellular injury class, we're talking here about cell destruction. That's why class in enzymes, if you're aware, enzymes, when you're going to test for enzymes, it's very important that you do not use hemolyze serum or plasma or other samples, because as mentioned here, they would usually appear in cellular injury. And if you use hemolyze serum or hemolyzed plasma or any hemolyzed sample, it would cause a falsely increased result. Then, enzymes would also appear in the degradation of cells or from storage areas. When we talk about storage areas class, these are where certain substances are stored in the body, such as the bile duct, and so on. Now, these are the conditions which would lead to the increased level of enzymes in the body. Elevated level of enzymes in the body would indicate organ damage. So let's say, class, there in your body there would be cellular injury. There's a degradation of cell. Your storage organ is injured or damaged. It would lead to an elevated level of enzymes. Now, the specific organ that is damaged is dependent on the location of the enzyme. So take note of that, class. To simplify this statement, for every enzyme, almost almost every enzyme class has a specific organ that is marked by it. Let's say class your ALPT or your SGPT, if it's elevated, if your ALT is increased, most likely there's a problem sa liver niya. Well, if your AST or SGOT is increased, more likely class there's a cardiac muscle or a tissue injury. So take note of that. Now let's talk about the enzyme nomenclature. Now when we talk about name nomenclature, these are basically how your enzymes are named. Now enzymes class, the naming of enzymes was formulated by the Enzyme Commission, your EC. This was a commission part which is part of the International Union of Biochemistry. So IUB class formulated or developed the Enzyme Commission. And Enzyme Commission was the one who was able to name enzymes. Now they named enzymes class based on the following: their biochemical function, their indicating substrate, and their reaction catalyze. Now for each specific enzyme class, there is an assigned systematic name and ID number. So yung ID number dito, please take note class, is composed of 4 digits. So the ID numbers are composed of 4 digits separated by decimal points. So pwede siyang 3, 0.2, 0.4, 0.1. It's 4 digits separated by decimal points. But in some times class, merong mga enzymes which would have 5 digits. So there are cases wherein the ID number of enzymes would be 5 instead of 4. So for every digit class, there is a representation. So the first digit class would refer to the enzyme classification. So later i-discuss ko yung ano yung mga enzyme classification na yan. There are a total of 6 classifications. While the second digit, so this is the first digit, this would refer to the enzyme classification. The second digit class would refer to the subclass. The third digit would refer to the subclass. And the last or the fourth digit would refer to the specific to each enzyme in a subclass. So parang siya yung identifying marker class, yung fourth digit. It's specific to that enzyme. It's like a serial number specific to each enzyme in a subclass. So for example, class, your acid phosphatase, ACP. ACP would stand for acid phosphatase. It has the nomenclature EC. EC here would stand for Enzyme Commission, followed by the 4-digit ID number. So these are the ID number. 3.1.3.2. They are separated by decimal points. Then you have your ALP, E.C, EC 3.1, 3.1. And then you have your Amylase, EC 3.2.1.1. ALP here class would stand for alkaline phosphatase. So that's your enzyme nomenclature. Now let's go to the enzyme classification class. So as I mentioned earlier, there are a total of 6 enzyme classification. We have number 1, your oxidoreductases. Now oxidoreductases class would catalyze the removal or addition of electrons. So they would remove or they would add class electrons. So yun yung tatandaan nyo about oxidoreductases. Just remember the removal or addition of electrons. It's usually involved with redox reaction. Example of enzymes belonging to oxidoreductases are your LDH, MDH, and G6PD. Now, the second classification class are your transferases. Transferases class, from the word transfer, it catalyzes the transfer of a chemical group other than hydrogen from one substrate to another. So let's have a recap class. Kapag oxidoreductases, removal or addition of electrons. If transferases, transfer of a chemical group other than hydrogen class. So hydrogen is not being transferred from one substrate to another. So pakitandaan, hydrogen is not being transferred in transferases. Enzymes belonging here are your CK, AST, and ALT. Then the third classification class is your hydrolases. They catalyze hydrolysis or splitting of a bond by the addition of water. So para matandaan nyo to, just remember the prefix hydro. Diba? Whenever you would hear the prefix hydro, it refers to water. So splitting of a bond by the addition of water. It's usually involved in hydrolytic reaction. Example of enzymes belonging here are your ACP and your ALP. Then we have your lyases. Now, lyases class would catalyze the removal of groups of substrate without hydrolysis. So in hydrolases class, the classification hydrolases, you're basically splitting a bond by adding water. But for lyases class, for lyases, you're removing a group without hydrolysis. Product would contain a double bond. An example of an enzyme belonging here is your glutamate decarboxylase. Then the fifth classification class is your isomerases. Isomerases catalyzes intramolecular arrangement of the substrate compound. Example of an enzyme belonging here are your glucose phosphate isomerase. So the thing you need to remember about isomerases class, there is the intramolecular arrangement. Yan yung keyword dyan if you want to memorize it. Isomerases, there's the letter I in isomerases and the letter I in intramolecular. So that's one way you could memorize that. Then the last classification class is the ligases. Ligases basically catalyze the joining of two substrate molecules. So ligases class, remember the word join. So it joins two substrate molecules. They would be coupled with breaking of the pyrophosphate bond in ATP or similar compound. An example of an enzyme in ligases class are your synthase. So those are the six enzyme classification. Now let's talk about the general properties of enzymes. So to better help you understand here, class, please refer to the picture at the center. So here we have your one property. There's what we call an active site. So all your enzymes class has this active site. Now itong active site na to, ito siya. So kung mari ito yung enzyme nyo, meron siyang parang there's a area there para siyang what do you call this, it's like a crevice, para siyang butas class. That's the active site. Now this cavity or this crevice class is a water free cavity, so it's a hydrophobic cavity. But walang tubig dyan, takot sila sa tubig. Now, this is the site where the substrate would interact with a particularly charged amino acid residue. So, take note of that class. This is where the substrate, so, kunwari class, this is the substrate. The substrate class would always go to the active site. So, the substrate would go to the active site. So, take note of that. Now, this is a three-dimensional protein structure where the substrate fits in before it is converted into its corresponding product. Diba, as mentioned earlier, enzymes basically catalyze reaction. Ini-enhance niya or in-speed up niya. So, basically, if you add the enzyme plus the substrate, it would form a product. So kapag yung substrate nag-attach if the substrate attaches to the active site, it would later on form a reaction leading to a product. Then the second property class is the allosteric site. Now, allosteric site is basically another cavity or another crevice other than the active site. So if in the picture, if this is the active site class, so So let's say this is the active site. Then the one here, the other site, this is the allosteric, allosteric site. So this is a cavity other than the active site and may bind regulator molecules. An example of a regulator molecule class could be your calcium and your magnesium. Now, enzyme class, please take note, is a protein. So let's go back to your biochemistry. If you remember class, proteins class are made up of amino acids. Now, this amino acids class would form polypeptide chain. If naalala nyo sa biochem nyo, di ba yung mga amino acids, yung mga bilog-bilog sila, that was the representation of amino acids. They would form this polypeptide chain. Now, this polypeptide chain or amino acids are what we call the primary structure. So the primary structure of enzymes are made up of amino acids. Now, this amino acids, itong mga bilog-bilog na to class, these chains, would now refer to the secondary structure. So, ulitin ko class ha, the primary structure, let me repeat, the primary structure is the amino acid. Now, when this amino acid, so para mas maintindihan nyo, this is the amino acid, this is the primary structure. Now, when multiple amino acids form a chain, they would now become the secondary structure. Now, once this secondary structure or these chains start to fold, magfo-fold sila class, it would now form the so-called tertiary structure. And once there is formation of folds or once there is a tertiary structure, this would now result to the formation of your cavities. Now, ano ba itong mga cavities na to? These cavities class would now refer to the active site and the allosteric site of your enzyme. So, if asked in your quiz, at what form of protein do cavities or do active sites and allosteric sites form, it's usually at the tertiary structure. Then another thing you need to take note of class about the active site is that no further binding can occur until an active site discharges its content. So imagine if this is your active site class. This is your active site. And then there would be here a substrate. Now, if the substrate is still attached to the active site, no other substance could attach to the active site. So if there's another substance here, it would look for another site, such as the allosteric site. So do take note of that. Now, here are the terminologies class. So we have your apoenzyme. Apoenzyme refers to the protein portion. This is the first portion of the enzyme. Then we have your coenzyme. Coenzyme class is the non-protein portion. This is usually the second portion of the enzyme. Now, the coenzyme class is the main participant during the reaction with the substrate. So take note of that class. Si coenzyme nyo is the one that would react or is the one usually involved during the reaction with the substrate. Then we have your prosthetic group. This is a coenzyme tightly bound to the apoenzyme. Then we have your holoenzyme. Holoenzyme is your apoenzyme plus prosthetic group. So again, class, prosthetic group is made up of coenzyme plus apoenzyme. Pag holoenzyme naman, this is made up of an apoenzyme plus a prosthetic group. So to simplify, apoenzyme plus coenzyme, you would form a holoenzyme. So for the third time class, ulitin ko, pag prosthetic group, coenzyme plus apoenzyme. Pag holoenzyme class, apoenzyme plus prosthetic group. Then we have your zymogen or proenzyme. This is an inactive form of digestive enzyme secreted originally from the organ of production. So familiar kayo dito class sa zymogen na to. Zymogens are basically, to give you an example, are inactive proteins. Ay familiar kayo sa hematology nyo. Hematology 2 nyo. We have your coagulation factors. Now, coagulation factors are represented by Roman numerals. Now, if you add, let's say, factor 12, your factor 12, if you add, the letter A, so if you add the letter A, this is an inactivated factor 12. So that's an example of a zymogen. Let's continue. Now, factors affecting enzymatic reactions, we have your catalytic or enzymatic activity. So there are around 10 factors plus that you need to consider. The first one would be the enzyme concentration. So if you have higher enzyme concentration, you would have a faster reaction. Meaning class, if you have more enzymes, mas madaming, if you have more enzymes, you have more active sites. And because there are more active sites class, there are more substrates, or substrates would be able to bind to more active sites. So with higher enzyme concentration, there would be more enzymes, specifically more binding sites for the substrate. Then we have your substrate concentration. So more substrate class, this would cause a steadily increase in the reaction rate. So take note that class, there's the word steadily. Hindi siya instant. Hindi porket naglagay, it doesn't mean that if you have more substrate, it rapidly rises. It steadily increases. This is a slow, not that slow class, but a slowly increasing reaction. Then we have your three cofactors. Now, cofactors class are non-protein entities that must bind to a particular enzyme before the reaction. So there are different types of cofactors class. The first one is the coenzymes. Now, coenzymes class are organic compound. This is the second substrate for enzymatic reaction. So organic compounds class, meaning they are usually substances in our body. So responsible for proper orientation of substrate with the active site. It has, if there's an increasing concentration of coenzyme, it would lead to increased speed or velocity of the reaction. Increased level of coenzyme in the blood or body means that the velocity of enzymatic reaction is also elevated. Important to achieve absolute enzymatic activity. When you say absolute enzymatic activity class, this refers to the max capacity or the max reaction. Examples of coenzymes are your NAD or your nicotinamide adenine dinucleotide and your NADP. So, dalagdagan lang siya ng letter P class. The letter P here would stand for phosphate. So again, NAD would stand for nicotinamide adenine dinucleotide, and if you add if it becomes NADP, the P would stand for phosphate. So NAD and NADP are examples of coenzyme. Then we have your activators. Now, activators naman class are inorganic ions. So they are the one altering the spatial configuration arrangement of the enzyme for proper substrate binding. So pag activators class, they're the one arranging the appearance of the enzyme. Example of activators are calcium, zinc, chloride, magnesium, and potassium. Increased levels of these electrolytes means there will be greater substrate binding. Then we have your metalloenzymes class. So this is another type of cofactor. So these are inorganic ions attached to a molecule. Example of metalloenzymes are your catalase and your cytochrome oxidase. Okay, the next factor affecting enzymatic reactions class are your inhibitors. Now, inhibitors, from the word inhibitors, they basically stop the binding or the attachment of the substrate to the active site. Now there are three types of inhibitors class. The first one is your competitive inhibitors. Now, competitive inhibitors class physically bind to the active site of an enzyme. So this is your normal enzyme reaction class. Here you would have your enzyme and your substrate. Now your substrate class, your substrate would go or would attach to the active site of your enzyme, forming a so-called enzyme substrate complex. Enzyme substrate complex, or the ES complex. Now this enzyme substrate complex would now produce products. Now, what competitive inhibitor does is instead of having the substrate attached to the active site of the enzyme, it will be the inhibitor. It will be the inhibitor that would be attached to the active site. And when that happens, class, there would be no reaction. It basically directly blocks the active site. For you to understand the reason why it's called competitive is because the inhibitor competes with the substrate. Now, both the substrate and the inhibitor would compete for the same reactive site. So, ulitin ko klasa, the reason it's called a competitive inhibitor because both the substrate and the inhibitor would compete for the same active site. Then we have your reversible inhibition. Now, reversible inhibition class, it's a reversible inhibition if the substrate concentration is higher than the inhibitor concentration. The effect of the inhibitor can be counteracted by adding excess substrate to bind the enzyme. So competitive inhibitor class is a reversible inhibition. So if you want to reverse this, you just need to add more substrate to bind the enzyme. Now, in this type of inhibition, you need to dilute the serum. So for you to counter effect it, you need to dilute the serum. It reduces the inhibitor concentration and would increase the reaction. It has the ability to alter the apparent Michaelis-Menten constant. Then the second type of inhibitor class is your non-competitive inhibitor. So it does not compete with the substrate class. So instead of attaching yung inhibitor, di ba sa competitive, nag-attach siya sa active site. This time sa non-competitive, it would not compete with the substrate. It would look for other areas other than the active site. The substrate and the inhibitor may bind an enzyme simultaneously. So instead of the active site class, dito sa non-competitive, it could attach to the allosteric site. Now, inhibition may be reversible or irreversible class. So you could reverse this or it could not be reversible. Now, it slows the rate of the reaction when it is bound to the enzyme. So take a look at this diagram class, or this picture. So in this non-competitive, so you would have here the substrate still attaching to the active site. But this time, the inhibitor would now attach to the allosteric site. And when that happens, it forms a so-called enzyme inhibitor complex. And because of this enzyme inhibitor complex, it changes the shape, or it binds the allosteric site, changing the shape of the active site, causing a no reaction. So ulitin ko klasa, in this type of inhibition, the inhibitor attaches to another site aside from the active site. And because of that, there would be a change in the shape of the enzyme, causing the substrate to not be compatible, and there would be no reaction. And the last type of inhibitor is your uncompetitive inhibitor. Sa uncompetitive inhibitor class, the inhibitor binds to the enzyme substrate complex. So the reaction has already occurred. Balik tayo dito para maintindihan nyo. Here you would have here you would have your enzyme substrate complex. What happens here is, kunwari itong bilog na to, this is your inhibitor. The inhibitor would bind to the enzyme substrate complex. So that's your uncompetitive inhibitor. Increasing substrate concentration results to increase inhibition, does not yield a product. So let's have a recap, class. Kapag competitive inhibition, inhibitor binds or competes with the substrate to the active site. Kapag non-competitive, inhibitor goes to the allosteric site. Kapag uncompetitive inhibition, inhibitor attaches to the enzyme substrate complex. So pakita. Let's go to the next one. Let's go to isoenzymes class. So another factor affecting is your isoenzymes. Now, isoenzymes class are polypeptide chains. These are tertiary structure, has the same catalytic reaction, meaning they come from the same family and there is only a slight difference on their molecular structure. So these isoenzymes class are similar, somehow similar, or basically they are one with the enzymes class, but they have a slight difference on their molecular structure, specifically the amino acid sequence of these enzymes. Now, total enzyme activity would be enhanced by fractionating the isoenzymes. Isoenzymes are different fractions of the enzyme. Once divided, we can measure total enzymatic activity. So we have here an example class is the amylase. Now, amylase class has two types of, or rather has two isoenzymes. The pancreatic amylase and the salivary amylase. And even your LDH and your CK. Diba sa CK, tatlo yan, CKMM, CKMB, CKBB, LDH, there are 5 isoenzymes. So those are your isoenzymes class. Basically, they are subtypes of the enzymes. And you need them if you want to measure the total enzymatic activity. Now, another factor affecting enzymatic reaction class is temperature. Now, when it comes to temperature, enzymes are the optimum temperature for enzymatic activity class is 37 degrees centigrade. We can also measure the activity of enzymes at other temperatures. Enzymatic activity class could also occur at room temperature, 25 degrees, 30 degrees, and 37 degrees. Increasing the temperature would basically increase the rate of a chemical reaction. The denaturation rate increases as the temperature increases and is usually significant at 40 to 50 degrees centigrade. So denaturation class, denaturation, when you hear denaturation, this is the temperature, or this is the condition wherein the enzymes are destroyed. So enzymes are destroyed class at 40 to 50 degrees, and if it reaches 60 to 65, there would be the inactivation of the enzyme. Then another factor affecting enzymatic reaction is your hydrogen ion concentration, or the pH. So physiological reaction, so the ideal physiological pH of enzymes is 7 to 8, and extreme pH level may result to structural change. It would also cause a change in the charge of amino acid residue. A very low or high pH can cause inactivation and denaturation of the enzyme. That's why it's very important, class, in your laboratory that when you test for the enzymes, it needs to be set at a proper pH. Usually, ginagawa na yun ng mga manufacturers. But the ideal would be 7 to 8. And if if the pH is very low or very high, it could cause a false reaction. Then we have your storage. So low storage temperatures would reversibly inactivate enzyme. So you cannot freeze, class. You're not allowed to freeze. You're not allowed to freeze your reagents when you test for enzymes. Now, repeated freezing and thawing would cause protein denaturation. So you cannot continuously freeze, then thaw, freeze and thaw. Madi-deactivate or madi-denature yung protein nyo, or yung enzyme nyo. If you want to preserve the enzyme for a longer period of time, store it at negative 20 degrees, the freezing temp. So if prolonged class, let's say prolonged gusto mo siya, you need to do it at negative 20. Then you can only you can only thaw it once. The ideal storage temperature class is the refrigerated temperature, usually 2 to 8 degrees centigrade. That's why yung mga reagents nyo for enzyme testing sa lab, stored sila class usually at ref temp. Then another factor is hemolysis. So most enzymes are found intracellularly. Rupture of RBC can cause falsely elevated enzyme results. Then number 10, the last one would be lactescence or milky specimen. Lactescence or milky specimen class can decrease enzymatic concentration. Now let's talk about your enzyme kinetics. Now enzyme kinetics class is basically how your enzyme and substrate attach to one another. Yung process. So there are different theories here. We have your lock and key theory. So this was also known as your Emil Fisher's theory. It's based on the shape of the key must fit into the lock. So if you notice in the picture, balik tayo dito sa enzyme substrate complex nyo. If you notice in the picture, the substrate would appear as the key, while the enzyme would be the lock. Now the key and the lock must always be compatible for a reaction to occur. And if it's not compatible class, katulad dun sa non-competitive inhibition wherein the shape is being changed, there would be no reaction. So that's Emil Fisher's theory, the lock and key theory. So the substrate is the key and the lock is the enzyme or the active site. So it has to be compatible. It has to fit into the lock. Then we have your induced fit theory. Induced fit theory is also known as your Cochran's theory. This is where in substrate binding to the active site and would allow some degree of conformational change. So in this induced fit theory class, the shape of the active site would adjust or would change depending on the substrate. So let me repeat, in induced fit, pinilit mo or you cause a change. You cause a change to the active site. So in induced fit theory, the substrate would cause a change to the active site shape, allowing the substrate to become compatible with the active site. Now, when we talk about substrate concentration class, we have this so-called Michaelis-Menten hypothesis. Now, Michaelis-Menten hypothesis states that the rate of conversion of substrate to product is determined class by the substrate concentration and by the rate of dissociation of ES complex. So to simplify this class, yung the product being produced by an enzyme substrate complex is determined by the amount of substrate and by the rate of dissociation of ES substrate complex. So pakitandaan itong dalawang to class. The conversion of substrate to product is determined by substrate concentration and by the rate of dissociation of ES complex. Now we have the so-called zero-order kinetics class. So zero-order kinetics states that reaction rate would depend only on enzyme concentration. So kapag zero-order kinetics class, sabi doon yung reaction ng enzyme is based only on the enzyme concentration. But if it's first-order kinetics, reaction rate is directly proportional to substrate concentration. So i-recap, if it's zero order, reaction rate depends on enzyme concentration. Kapag first order, directly proportional to substrate concentration. Now there are different methods of enzymatic reaction on how you would measure it. Usually class ang pinaka-common na ginagawa sa lab would be the coupled reaction. In coupled reaction, there would be a colorimetric change, may change in color. Now let's talk about them one by one. We have the fixed time. Now fixed time class is also known as your endpoint analysis. This is a combination of reactants. Reaction proceeds for a designated time. Reaction is stopped and the measurement is made. Then we have your continuous monitoring, also known as your kinetic assay. Multiple measurement of change absorbance are made during a reaction. Then we have your multi-point assay. It measures the change in the concentration of the indicator substance at several intervals. So in the laboratory class, you would be encountering these different methodologies. And most of the time, in an example class dito sa fixed time nyo, in this continuous monitoring nyo, you will encounter this type of assay in your lipase testing. Let's continue. Now, let's talk about how your enzyme activity are measured. So we have your substrate concentration. So in substrate concentration, the reaction would start with a higher substrate concentration. The change in substrate concentration is measured. This means that as the substrate decreases, it corresponds to an increased enzymatic activity or increased level of enzyme. So again, class sa substrate concentration, ang tandaan nyo, at the start class, there would be an increase substrate. But as the reaction, as the reaction speeds up, the substrate decreases. So there would be a decreased substrate. And when there is a decreased substrate class, it corresponds to an increased enzyme activity. So let me repeat, at the beginning, your substrate, you have a high substrate concentration. But as the reaction progresses, increases, it causes your substrate to decreases. And when you have a decreased substrate, it means that there is an increased enzymatic activity. So walang inhibition, hindi nag-stop yung reaction. Now let's go about to product concentration. So in product concentration class, the reaction would start with zero initial product. So walang product na napoproduce class. Now among the three methods of measurement of enzyme activity, the product concentration is considered to be the most accurate. Which is true naman class, diba? As the reaction starts, walang product, walang kahit anong contaminants, but as the reaction continues, there would be a gradual increase of the product. So it's very accurate. There would be less interferences. Then we have your coenzyme measurement. We are measuring the decrease and increase in the levels of coenzyme. Now let's talk about the units expressing enzymatic activity. So we have your IU, or the international unit. So this is the international unit class, is the conventional unit. It's written as international unit per liter, or some would use units per liter. In the laboratory, most of the time, we would use IU per liter to express enzyme activity and concentration. So if familiar kayo class, di ba kapag may conventional unit, meron din tayong tinatawag na SI unit. So the SI unit for enzymatic activity is the Catal unit, or the KU. KU is like mole per second. So this is the SI unit, and it's written as catals per letter. So lahat ng substances nyo, tinatanong to sa board exam class. They have the so-called conversion factor. So the conversion factor would be used in converting the conventional unit to SI unit. Usually, katulad dito, ACP, the conversion factor is 16.67. So do try to memorize only the enzymes dito sa table na to. Enzymes lang ha. Huwag nyo nang isama muna yung calcium, yung chloride in the next lessons na yun. But do memorize them, the conversion factor of the enzymes. They may come out in your quiz. Now, what are the causes of elevated plasma enzyme levels? So we have your impaired removal of enzyme from plasma. So impaired removal of enzyme from plasma, increased permeability of cell membrane. So there would be increased permeability. Pag sinabi mong permeability, the enzyme would be able to easily pass through. Increase in the number of cells or production of cells, increase in the normal cell turnover, decrease cell clearance of enzymes from the circulation, and tissue necrosis and degeneration. So these are the 6 causes of elevated plasma enzyme levels. Now let's go to the major clinical enzymes that we would discuss this class. So ito yung mga enzymes of clinical significance. We have your ALP, your ACP, your AST, ALT, amylase, lipase, LDH, CK, and aldolase. So let's start with the phosphatases class. So other phosphatases, we have your ALP and your ACP. So let's begin with ALP. ALP refers to alkaline phosphatase. Alkaline phosphatase class was previously known, or yung full name niya talaga is alkaline orthophosphoric monoester phosphohydrolase. This is considered class as a non-specific enzyme because it has the ability to react with many different substrates. So non-specific enzyme siya class could react with different substrate. It hydrolyzes phosphomonoester from an organic phosphate ester to liberate inorganic phosphate and alcohol. Organic phosphate ester to liberate inorganic phosphate and alcohol. In the presence of ALP, our end products would be inorganic phosphate and alcohol. So if you have your enzyme ALP here class, ALP plus substrate, pakitandaan to ha, ALP plus substrate, the products would be inorganic phosphate and alcohol. So if asked in your quiz what are the products of ALP, it would be inorganic phosphate and alcohol. Now the major tissue source of ALP class would be the liver, the bone, the spleen, the kidney, the placenta, and the intestines. Now we have different isoenzyme or classes of ALP, which are dependent on the location or source of the enzyme. Particularly class, the highest concentration of ALP class is found in the liver. Then other sources would include the bone, the spleen, the kidney, the placenta, and then the intestine. The reference value class for ALP is 30 to 90 units per liter. Conversion factor is 1. Now, what is the diagnostic significance of your ALP? Now, when it comes to ALP class, pag naririnig nyo lagi ang ALP, it's always related to the bone. Bakit hindi yung liver, sir? You may be wondering, sir, why is it not specific for liver if it's most abundant in liver? Remember, class, when we talk about liver, it's always your ALT that is most sensitive compared with your ALP. Now, ALP is more on bone disorders because your ALP has a what we call bone isoenzyme. Now, this bone isoenzyme class would usually increase due to osteoblastic activity. In healthy individuals, most of the ALP in the body will come from the liver and the bone. Now, it normally increases in children during the period of growth, in adults at geriatric age, usually at the start of bone degeneration. Then it also increases in a mother or in a person having in a woman having a normal pregnancy. Increased levels of ALP, especially on the 4th month. Pakitandaan ito, ALP would increase at the 4th month after the 5th month. So 16 to 20 weeks. And then towards the 3rd trimester class, the last 3 months of pregnancy, ALP levels tend to elevate 2 to 3 times more and will continue to increase until delivery. So, it increases class at the start of the fourth, after the fifth month of pregnancy. Then it becomes 2 to 3 times higher at the third trimester. And it would return to normal levels 3 to 6 days after delivery. Now, it remains increased if pregnant woman suffers from eclampsia, where blood pressure increases, causing elevated ALP. So, take note of that. Now, ALP levels, especially in the intestines class, are dependent on the blood group of an individual, whether you have the secretor gene or H gene. Individuals having B and O blood group class are expected to have them having increased ALP levels. So if you are blood type B and blood type O class, you have an increased intestinal ALP levels. And this would usually occur during or after a fatty rich meal. So take note of that ha. Ulitin ko, if you are blood type B and blood type O, it is expected class that you have higher intestinal ALP, especially after a fatty rich meal. In pregnant women having A and AB blood groups, ALP levels tend to be lower even if they are pregnant as compared to B and O. So let's have a recap class ha. Kapag B and O blood group ka, mas mataas ang intestinal ALP mo. But in pregnant women, if that is blood type A or blood type AB, they tend to have lower ALP as compared to B and O blood groups. Now let's talk about the major ALP isoenzymes. So there are four. We have the liver, the bone, the placental, and the intestinal ALP. So let's first talk about the diagnostic significance of the liver ALP. So liver ALP class, ALP elevations are usually seen in hepatobiliary disorders and bone disorders. So whenever we would hear the word hepatobiliary, ang maaalala mo dapat dito is always obstructive. Obstructive jaundice. So in this type of disorder class, elevations are more predominant in obstructive jaundice. Other conditions would include intrahepatic cholestasis, space-occupying lesion, biliary cirrhosis, viral and alcoholic hepatitis. Now, how would you differentiate obstructive jaundice from hepatocellular jaundice? Pag sinabi mong hepatocellular jaundice class, this is usually caused by a problem in the liver. Pero kapag obstructive jaundice lang, usually affecting dito yung gallbladder mo, wherein there is an increase in the production of the bile products. So ALP levels are more significant on obstructive jaundice. So ALP or the liver ALP is higher on obstructive jaundice. Slight increase naman in hepatocellular jaundice. So let me repeat class, if the patient has obstructive jaundice, ALP levels are high. But if it's hepatocellular jaundice, slightly increased lang siya. Then we have your bone ALP. So these are disorders when there is involvement of the osteoblasts. Highest elevation class is seen in your Paget's disease or your osteitis deformans. In this type of disorder, patients are prone to bone breakage. Very, very fragile ang bones nyo dito, class. So there would be bone breakage or fracture. Therefore, osteoblasts are affected, thus having elevated ALP levels. Other conditions class would include rickets, osteogenic sarcoma, hyperparathyroidism, metastatic bone CA, and osteomalacia. So kapag rickets class, diba, just a recap lang, you have vitamin D deficiency. Pag osteogenic sarcoma, this is a type of cancer or tumor. If it's hyperparathyroidism, remember ang hyperparathyroidism nyo is related to the parathyroid hormone, which would affect the level of vitamin D. Then we have your metastatic bone cancer. Then we have your osteomalacia, characterized by having weakening of the bones. Thus, they are prone to fracture or breakage as caused by vitamin D deficiency or sometimes caused by calcium deficiency. Then, under bone ALP class, we have an isoenzyme, the B1X. Now, B1X class is an isoform of a bone ALP isoenzyme. Now, it's usually related class to bone mineral disease. BMD here stands for bone mineral disease in patients with chronic kidney disease. This one is common among individuals undergoing dialysis. This is specifically used to study BMD in patients with CKD and increase of individuals with BMD of the hip. B1X is also expected to increase if the affected part is the trabecular bone. So makikita mo tong si B1X class in patients with bone mineral disease undergoing dialysis due to CKD. And usually related siya kapag meron kang or affected yung trabecular bone mo. Now let's go to the last two, the intestinal and the carcinoplacental ALP. So the intestinal ALP class is used to differentiate between intrahepatic and extrahepatic jaundice. Kapag intrahepatic, meaning it's related to the liver. Kapag extrahepatic class, it's basically a post or prehepatic jaundice, and it can usually be obstructive. Then we have your carcinoplacental ALP. Now, under carcinoplacental ALP, please remember this. We have the Regan ALP. So present in the cancer. So usually found for carcinomas to class. It serves as a marker for carcinomas, cancers. Present in the cancer of the lungs, breast, ovarian, and other gynecological CA. This is a bone ALP co-migrator. Pag sinabi mong bone ALP co-migrator, it migrates in the same position with the bone fraction during electrophoresis. Now, your Regan ALP class, your Regan ALP is the most heat-stable ALP and can resist temperatures of up to 65 degrees centigrade for 30 minutes. Other ALP isoenzymes can easily be affected with heat. It is inhibited by phenylalanine. Then another type of ALP under carcinoplacental ALP is the Nagao ALP, present in the adenocarcinoma of the pancreas and the bile duct, pleural surfaces, variant of Regan ALP. So this is a variant of Regan ALP class, inhibited by L-leucine and phenylalanine. Almost the same activities with Regan ALP except that its activity is inhibited by L-leucine and phenylalanine. So kung si Regan ALP nyo class is only inhibited by phenylalanine, si Nagao ALP nyo is also inhibited by phenylalanine, but this time it's also inhibited by L-leucine. So this is the summary of your ALP isoenzymes. So the liver class is not inhibited, stable siya. Not inhibited by L-phenylalanine. The bone ALP is also not inhibited by L-phenylalanine. Intestine, placental, and Regan are inhibited by L-phenylalanine. Then take note of the order of anodal migration. So the fastest class would be the liver, followed by the bone, followed by the placental and the Regan, and the last would be the intestinal ALP, meaning this is the slowest. Then differential diagnosis of liver and bone ALP. Usually, class, you would use other enzymes to differentiate liver and bone disorders. So kapag may liver disease ka, the following enzymes are increased: ALP, 5' nucleotase, LAP, GGT. But if you have a bone disorder, increase lang ang ALP. So let's say the doctor tested for this 4 tests in order to ng doctor. Among the 4 tests, only ALP is increased. If that happens, class, the doctor will presume that the patient is suffering from a bone disorder. So that's how you would differentiate them. Now let's go to the assay for enzymatic activities for ALP. So we have here the first one, electrophoresis. Now electrophoresis for ALP would use neuraminidase and with germ lectin. Now neuraminidase and with germ lectin class would improve separation of bone ALP from liver ALP. Most useful single technique for measurement of the enzymatic activity of ALP. Now again, liver is the fastest siya yung mga most anodal, while the slowest or the least anodal class is the intestinal ALP. Then we have the heat fractionation or stability test. This is measured when they are exposed to heat. Temperature is set at 56 degrees centigrade for 10 to 15 minutes. Then decreasing order of heat stability. So the most heat stable is yung Regan or the placental, followed by the intestinal, liver, and bone, which is the one that is the most heat labile. So take note of that class. So ulitin ko, the most heat stable is the placental or the Regan, followed by intestinal, liver, and the most heat labile is bone. Then we have your chemical inhibition test. We have your phenylalanine. Placental and intestinal ALP is inhibited by phenylalanine. Then we have your 3M urea. 3 molar urea class would inhibit bone marrow ALP. Levamisole inhibits liver and bone ALP. Then we have the test, yung Bowers and Bacombe. This is also known as your SAS modification. This is the most specific method, considered as the enzymatic method for ALP. This is IFCC recommended method, requires a pH environment of 10.15, read at 405 nanometers, and the color end product is yellow. So this is the ALP assay summary class. So marami kasi siyang method na ginagawa, and they have different substrates and they have different end products. So kindly try to memorize this. This may come out in your quiz or exam. Now let's go to the second phosphatase class, the ACP or the acid phosphatase. Now acid phosphatase class, like your ALP, has also a name. The acid orthophosphoric monoester phosphohydrolase. So ACP class catalyzes the same reaction made by ALP, except it is active at a lower pH, usually at a pH of 5 or lower. So kaya siya tinawag na acid because it works or it causes a reaction at an acidic pH. Activity greater than 50 IU per liter indicates the presence of seminal fluid. So if you're able to detect from a sample of 50 international units per liter, it indicates that the sample is contaminated with seminal fluid. Tissue sources class would include the prostate, RBC, platelets, liver, and the bone. Reference value class, male 2.5 to 11.7 U per liter. This is for the total ACP. So total ACP to class sa male 2.5 to 11.7, while the prostatic ACP is 0.3 to 5 nanogram per ml. Now, what is the diagnostic significance of ACP class? For the detection of prostatic adenocarcinoma, after surgical treatment of prostate CA, levels fall faster than PSA. So your PSA here would stand for prostate specific antigen. So in if the patient is suspected to have prostate cancer, usually class, you would be doing surgery. So after surgical treatment, prostate CA levels fall faster than PSA. Plasma levels are expected to be undetectable. Use in forensic clinical chem. indication of seminal fluid presence and is usually used for rape cases. Specimen use class is vaginal washing. So sa vaginal washing nyo, if there is at least 50 international units per liter of ACP, suspected may seminal fluid class and the patient could be raped or could have been rape class. Specimen validity would last for 4 days since the rape incident. Other causes of increased ACP activity class would include urinary tract obstruction, acute urinary retention, extensive prostatic massage. Usually, itong massage na to class ginagawa for those with enlarged prostate to help in size reduction. Prostatic inflammation, infarction or ischemia, prostatic manipulations, and needle biopsy. Then we have your prostatic ACP. Now, prostatic ACP class is inhibited by L-tartrate ions. Then we have your red cell ACP inhibited by cupric sulfate and formaldehyde ions. Then we have your so-called TRAP. TRAP would stand for tartrate-resistant ACP. Present in chronic leukemia and hairy cell leukemia. Now, if the sample or if the patient has elevated serum bilirubin, it causes falsely decreased or falsely low values for your TRAP. So, pakitandaan to class ha, for prostatic ACP inhibited by L-tartrate, red cell ACP inhibited by cupric sulfate and formaldehyde ions. Then si tartrate-resistant ACP seen in types of chronic leukemia and yung tinatawag nating hairy cell leukemia. And elevated serum bilirubin would cause falsely low values for TRAP. Now, these are the ACP assays class. So, I just want you to focus on the four, itong apat na, no? Now, there, you would notice here, di ba, may mga substrates sila. So, just to give you an idea, itong thymophthalate monophosphate nyo, the purpose for this is used as a substrate for endpoint reaction. So this is the substrate that is used for endpoint reaction tests, a quantitative test. Then we have your alpha-naphtol phosphate. Alpha-naphtol phosphate class is a substrate used for continuous monitoring. So paki-memorize class yung mga substrate and yung mga end products. This may come out in your quiz, and even in your exam. Then we have your transferases and transaminases. So under transferases and transaminases, we have your AST and your ALT. AST stands for aspartate aminotransferase, and the SGOT is the serum glutamic oxaloacetic transaminase. Then ALT would stand for alanine aminotransferase. SGPT would stand for serum glutamic pyruvic transaminase. Okay, let's start with your aspartate aminotransferase class or your AST. So aspartate aminotransferase class would catalyze the transfer of an amino group between aspartate and alpha keto acids, leading to the formation of oxaloacetate and glutamate. So yung products nyo dito class, the products of your AST are these two, si oxaloacetate and glutamate. So, pakitandaan yan. If asked in your quiz, what are the products of AST? It's oxaloacetate and glutamate. So, the major tissue source class would include cardiac tissue, liver, and skeletal muscle. Other sources would include the kidney, the pancreas, and the RBC. Reference value is 5 to 37 U per liter. Then there are two isoenzyme fractions for AST class, the cytoplasmic AST and the mitochondrial AST. Among the two class, ang pinakamadami or the ones that more predominant is the cytoplasmic AST. So cytoplasmic is predominant than mitochondrial AST, meaning mas madami siya or it's more abundant than mitochondrial AST. Now, what is the diagnostic significance of AST class? Ang pinaka-diagnostic significance niya would be in the use of AMI, hepatocellular disorders, and even skeletal muscle involvement. Now, in AMI class, in acute myocardial infarction, AST levels would begin to rise within 6 to 8 hours after the attack. Magpipeak siya at 24 hours. So if you try to put this in a graph, magra-rise siya within 6 to 8 hours. And it would peak, magpipeak siya class at 24 hours. And it would return to normal within 5 days. So let me repeat. It rises within 6 to 8 hours, peaks at 24 hours, and returns to normal or subsides within 5 days. Now, this is used for the diagnosis of chronic hepatitis class. Usually, ang chronic hepatitis nyo would be also seen in hepatitis B, C, and others. Now, hepatitis A is an example of acute hepatitis and also monitoring of hepatotoxic drugs. So, some metabolism of drugs are toxic to the liver. If the drug is toxic to the liver, AST is 3 times higher than the upper border. So ano ba yung upper border class? If your reference value, balik tayo dito. If your reference value is 5 to 37, yung unang number class, that's the lower limit or the lower border. Kapag yung second number naman is the upper limit or the upper border. So sabi dito, 3 times higher than upper border kapag yung liver mo is toxic due to drugs. So, di ba 37 yan, 5 to 37. So, 37 times 3 would be equal to 90 plus 21, 111 class. So, a value of 111 or higher could indicate that the liver is suffering from drug toxicity. Now, assay for AST class. Now, the assay for AST is based on the Carmen method, set at a pH of 7.5, read at 340 nanometers. This is a coupled enzymatic reaction. It uses an indicator class malate dehydrogenase or the MDH. So this is another type of enzyme class. Monitors the change in absorbance at 340 nanometer. Let's go now to the second one, yung ALT nyo or yung SGPT. ALT catalyzes the transfer group of amino group from alanine to alpha ketoglutarate. So ang products nyo class, the products produced here are pyruvate and glutamate. Major tissue source are the liver. Highest concentration of ALT is found in the liver, but it is also present in the cardiac tissue and muscle. On the other hand, AST or SGOT's highest concentration is found class in the cardiac tissue. That is why class between ALT or ALT class is the one that is more specific siya. It's more specific siya sa liver, while AST is more on the cardiac tissue. Other sources for ALT would include the kidney, the pancreas, the RBC, the heart, the skeletal muscle, the lungs. Normal value is 6 to 37 U per liter. Now, what's the diagnostic significance of ALT class? Usually for hepatic or liver disorders, especially hepatitis. ALT is used to monitor acute hepatitis, especially hepatitis A. There is abnormally high ALT if the patient has acute hepatitis or hepatitis A. More specific in detecting liver disease in non-alcoholic patients. So, pakitandaan yan, class. If the patient is non-alcoholic, hindi umiinom, pero nag-develop siya ng liver disease, you would ideal gamitin ng ALT. Usually, kapag may liver disease ka tapos non-alcoholic ka, it could be a type of hepatitis viral infection. Increased levels would prompt acute hepatitis. Now, if the patient is suffering from viral or toxic hepatitis, usually ALT levels are 20 times higher than the normal limit. This is an extremely high transferases and you would be able to see class in viral toxic hepatitis, jaundice. So this is a yellow discoloration of the skin, di ba? And even the eyes. Amber or dark brown urine. Now, when wiping the target puncture site, the cotton would become yellow. So in your internship, may encounter nyo yung mga ganitong patient that are suffering from jaundice class. Kapag may jaundice sila, they would when you wipe the puncture site, ano ng yellow yun. Now, in ALT class, we have this so-called deritis ratio. Now, deritis ratio is the ratio between ALT and AST. Now, in a patient with acute hepatitis, the ratio is usually greater than 1, meaning class mas madami si ALT. ALT is higher than AST. This is a slight increase of both transferases. If there's a slight increase of both transferases class, this could indicate obstructive jaundice. But if it's markedly increased class of both transferases, there is necrotic jaundice. So slight increase ng ALT-AST obstructive. Pag markedly increase, necrotic jaundice. Now, we have what we call end-stage cirrhosis class. So end-stage cirrhosis is a type of it can cause necrotic jaundice. Kapag end-stage cirrhosis class kasi basically dying na yung liver mo. Now, the levels of the enzymes are not elevated and may be low. So, hindi siya elevated, normal siya, but could be low. There would be normal or very low level of transferases. Kaya siya tinawag na end-stage class, again, papatay na siya, mamamatay na siya. There is a massive tissue destruction. And because of this massive tissue destruction class, less enzyme would be produced. Now, what are the assay for ALT? So we have your reaction with your DNPH. This is also known as the Frankel-Reitman assay. Now, DNPH would stand for nitrophenylhydrazine. This is an enzymatic reaction. The keto acid formed during the reaction will combine or is allowed to react with DNPH, resulting to the formation of a blue compound. Measurement would require absorbance at 505 nanometers. Then another test is the coupling with diazonium salt. This is known as the Babson reaction or the Babson test. Enzymatic reaction. This is an enzymatic reaction. Keto acid is allowed to react with diazonium salt. Visible result is a violet or purple product. Then the one that is also used in AST class, the coupled enzyme reaction, the Carmen or the Walker method or the Walker test. Coupled, this is wherein two enzymes are involved. The form keto acid is allowed to this is react class. React with NADH. So NADH is the first enzyme. Then reduction in the absorbance is measured, and if there is greater reduction of the absorbance, it means that there is greater activity of the enzyme. So the greater the reduction of the absorbance class, the greater the activity of the enzyme. So directly proportional siya. Now, in the coupled or in the Carmen or Walker method, pakitake note, LDH is the indicator for ALT. The pH is set at 7.5. Absorbance wavelength is 340 nanometers. Alanine and alpha-ketoglutarate are in the reagent. ALT is present in the sample. End product of coupled enzymatic reaction for ALT are your lactate and NAD. Reduction from NADH to NAD in the absorbance is measured. So this is the summary of your transferases class. So kindly memorize them. They may come out in your quiz or even in the exam. Now, conditions where both AST and ALT are high, we have your toxic hepatitis, the Wolff-Parkinson-White syndrome, chronic alcoholism, hepatic cancer, Ray's syndrome, viral hepatitis, and dermatomyositis. Then conditions where AST class is higher than ALT. We have your acute myocardial infarction, trichinosis, muscular dystrophy, and acute pancreatitis. Now let's go to the pancreatic enzymes naman class. So for the pancreatic enzyme, we have your amylase or your AMS. Amylase is also known as your alpha 1 for glucan for glucohydrolase. So this belongs to the group of hydrolases class. It catalyzes the breakdown of starch and glycogen. Salivary amylase and pancreatic amylase are very important in the digestion of starch. For amylase class, it would require calcium and chloride for the activation in order to perform its activity. Filtered by the glomerulus, considered to be the smallest enzyme. Thus, it can pass through the kidney appearing in the urine. So, siya yung pinaka-smallest enzyme class, and because of its very small size, it can easily pass through the kidney, appearing in the urine. Now, the major tissue source class is the acinar cells of the pancreas, specifically the pancreatic amylase, and the salivary gland, where the salivary amylase would come from. As I mentioned at the start of the presentation or the discussion, there are two types of amylases, the pancreatic and salivary. So you would find them in the pancreas and in the salivary gland. Earliest pancreatic marker class. Other tissue source would include adipose tissue, fallopian tube, small intestine, and skeletal muscle. Reference value is 95 to 290 U per liter. Now, there are two isoenzymes class for amylase. We have the S-type. The S-type is also known as your vitayalin. Under the S-type, we have subtypes S1, S2, S3. This is a fast-moving, meaning it migrates quickly class. Siya yung pinakamabilis. Siya yung most anodal during electrophoresis. The source of the S-type is the salivary gland as well as the fallopian tube and the lungs. Then we have the P-type. The P-type is also known as your amylopsin. It also has subtypes P1, P2, and P3. Siya yung slow moving. Siya yung least anodal. So, ang fastest class is the S-type while the slowest is the P-type. Now, kaya siya tinawag na P-type because the source is derived from pancreatic tissue. Now, P-type is predominantly present in normal urine class. So, nakikita siya sa urine while the S-type is found in normal serum. But both can be present in the urine and serum. So, si P-type class, mas madami siya sa ihi. Si S-type, mas madami siya sa serum. But you could still detect them both in the urine and serum. Mas madami lang si P-type sa ihi or sa urine, mas madami naman si S-type sa serum. Now, anong diagnostic significance ng amylase? Diagnostic significance class is for acute pancreatitis. Usually increase 5 to 8 hours after the onset of the attack. Earliest marker for any problem with the pancreas. Predominating isoenzyme in acute pancreatitis class, please take note, is yung P3. P3 ang pinakamadami kapag meron kang acute pancreatitis. In some books class, please take note that amylase will rise 2 to 12 hours. So pag nilagay na naman natin siya sa graph, magra-rise siya 2 to 12 hours after the onset of the attack. It would now peak 24 hours. Magpipeak siya after 24 hours and would return to normal 3 to 5 days. So let me repeat. Kapag meron kang acute pancreatitis class, amylase would rise 2 to 12 hours. 2 to 12 hours. Magpipeak siya 24 hours class and then returns to normal within 3 to 5 days. But take note class, in acute pancreatitis, you would have increased urine amylase for up to 7 days. Ganon katagal. 7 days. Then we have your parotitis. Parotitis class is usually seen in mumps. Namamaga or inflame ang inyong parotid gland. So if you have an inflamed parotid gland in mumps, you would have increased amylase also. renal failure class. So sa renal failure, you would have increased plasma amylase, increased plasma amylase, decreased urine amylase. Then we have the so-called macroamylasemia. Macroamylasemia class would usually occur when your amylase combines with antibodies or immunoglobulin. If that happens, it would cause an elevated amylase level, normal amylase in the urine, but increase in the blood. Other conditions with increased amylase class would include peptic ulcer, involving pancreatic amylase, intestinal obstruction, cholecystitis, ruptured ectopic pregnancy, mesenteric infarction, acute appendicitis, renal insufficiency, diabetic ketoacidosis, and alcoholism. Now, sources of error for amylase class. So, please take note that heparin and triglycerides would inhibit the activity of amylase. So, samples with high amylase activity. So, kung yung sample mo class has very high amylase activity, you need to dilute it. So, you could use sodium chloride or NSS. The lowest dilution is 1 is to 2. Kapag 1 is to 2, you could use 100 UL ng serum and 100 UL ng NSS to dilute it. Now, which germ lectin class would also cause or would also inhibit, causing a falsely decreased level? Morphine and other opiates class would cause a falsely increased or falsely elevated amylase in the serum. Now let's go to the amylase method. So under amylase method, we have the saccharogenic method. This is expressed in some Mogi units. Measures the amount of reducing sugars produced by the hydrolysis of starch by the usual glucose method. So itong saccharogenic method nyo class, minimeasure niya yung reducing sugars nyo after the hydrolysis of starch. This is a classic reference method. Very old method na to, hindi na siya ginagawa class. Substrate, ginagawa pa rin siya but it's really substrate is used is starch. It is hydrolyzed by amylase into its constituent carbohydrate if the sugar present has reducing property and capability. Amount of reducing sugar is directly proportional to the activity of amylase enzyme. The reaction of starch with amylase is done at 37 degrees centigrade for 30 minutes. So components involved here in this method is the reducing sugar plus the amylase, which starch as the substrate. Then we have your amyloclastic. So sa amyloclastic class, tatandaan nyo dito is it would usually involve the use of iodine. So AMS or amylase is allowed to react on a starch substrate to which iodine has been attached. Upon hydrolysis, iodine would be released. Decrease occurs in the initial dark blue color intensity of the starch iodine. So the color from dark blue class will gradually lighten. The decrease in color is proportional to the amylase concentration activity. The lighter the color class, the greater the amylase activity. So sa amyloclastic class, mag-i-start ka from a dark blue color. And if madaas yung presence ng amylase nyo, high yung amylase nyo, if you have high amylase in your sample, it would lead to a lighter color. So from dark blue, pwede siya maging blue to light blue. Then we have your chromogenic method. So chromogenic method, you would be using a chromogenic dye plus the substrate forming a so-called insoluble dye-substrate complex. Again, starch is the substrate. Upon hydrolysis, smaller dye-substrate fragments are produced. These fragments are water-insoluble class. So the darker the color, the greater the activity of the amylase. So baliktad naman to class. Dito class, the darker the color, the greater the amylase activity. The increase in color intensity is directly proportional to the amylase activity. Change in observance of NAD is measured at wavelength of 340 nanometers. Then we have your coupled enzymatic reaction or the coupled enzyme. It would involve numerous enzymes class. Maltopentose is present in the starch. Purpose of amylase is a catalyst of the chemical reaction. The coupled enzyme reaction for amylase is a reversible reaction. So ito yung class. So maltopentose. So itong maltopentose na to, this is usually found in your starch. Now, upon exposure to amylase, yung maltopentose na nasa starch would be converted to maltotriose plus maltose. Now, si maltotriose plus maltose with the enzyme alpha-glucosidase would convert it into 5-glucose. 5-glucose plus 5-ATP with the help of the enzyme hexokinase would convert it to 5-glucose 6-phosphate plus 5-ADP, and 5-glucose 6-phosphate plus 5-NADP. NAD would be converted by G6PD to 5,6-phosphogluconolactone 5-NADH. So ito yung mga enzymes involved dito sa coupled enzymatic reaction class: amylase, alpha-glucosidase, hexokinase, and G6PD. Now let's go to the second pancreatic enzyme, yung lipase class. So lipase is also known as your triacylglycerol acyl hydrolase. So this is responsible for the hydrolysis of ester linkages of fats to produce alcohol and fatty acid. Partial hydrolysis of dietary triglycerides to the 2-monoglyceride intermediate, most specific pancreatic marker, while amylase is the earliest marker for pancreatitis. Major tissue source is the pancreas. Lipase is exclusively secreted by or sourced from the pancreas. So, compared mo siya sa amylase class, di ba si amylase, aside from the pancreas, it could also be found in the salivary gland. But si lipase class, ang only source niya is the pancreas. Only exclusively secreted, not affected class by any renal dysfunction or disease. Other tissue source class are the stomach and the small intestine. Very small amounts are produced in other tissue source. Reference value is less than 38 U per liter. Now, anong significance niya class? So, lipase is very significant in acute pancreatitis. If the patient is suffering from acute pancreatitis, magra-rise siya. It would rise within 4 to 8 hours. Magpipeak siya in 24 hours and returns to normal after 8 to 14 days. So, ganun katagal class. Very accurate siya kasi even if after a very long time, elevated pa rin siya. So, let me repeat. Magra-rise siya 4 to 8 hours after the attack of your acute pancreatitis, peaks within 24 hours, and would return to normal within 8 to 14 days. Then we have your chronic pancreatitis, chronic inflammation of the pancreas, acinar cell degradation, loss of amylase and lipase production. Levels of lipase and amylase are depleted or decreased. Other conditions with elevated lipase would include perforated peptic ulcer, intestinal obstruction, acute cholecystitis, and penetrating duodenal ulcers. Now, yung mga method class, the method for lipase method would usually use the substrate olive oil. Olive oil class is considered as the best substrate. Other esterases that can be used as substrate hydrolyzes triglyceride and diglyceride, while olive does not. So, very specific siya class for lipase, yung olive oil nyo. Addition of colipase and bile salt would increase the sensitivity and specificity for the detection of acute pancreatitis. So if you add colipase and bile salt, tataas yung sensitivity niya and specificity for acute pancreatitis. Now take note class that hemoglobin inhibits lipase activity. And remember, hemoglobin is released from RBCs. So again, bawal ang hemolyzed sample. Hemolyzed sample would cause a decreased activity of lipase. Then we have your triolane. So triolane class could be used as a substitute for olive oil. It could act as a substrate and is a more pure form of triglyceride. So kung walang olive oil na available, you could use triolane class. So these are the methods used. We have your cherry crandall, your titsanferic, and your peroxidase coupling. So peroxidase coupling class is the most commonly used method. Does not require the use of olive oil as a substrate. Yung cherry crandall nyo class, please take note, is the reference method for lipase determination. Principle niya class is hydrolysis of olive oil after incubation for 24 hours at 37 degrees centigrade and titration of fatty acid using sodium hydroxide. Substrate is 50% olive oil. End product is fatty acids. So we have here your triglyceride plus water. It will be converted to lipase to form 2 monoglyceride plus 2 fatty acids. So ito yung products class ng lipase nyo. 2 monoglyceride and 2 fatty acid. Now let's go to another enzyme class, si LDH nyo. LDH nyo is also known as your lactate dehydrogenase. Among all the enzymes class, siya yung madalas na nakikita sa entire body. Found in almost all cells in the body. Responsible for the interconversion of lactic acid, lactate, and pyruvic acid. So kaya niyang mag-form ng mag-cause ng reversible reaction between lactic acid and pyruvic acid or lactate and pyruvate. Part of the glycolytic pathway. Zinc containing excuse me, zinc containing enzyme. Now its coenzyme class is NAD, usually produced from the breakdown of RBCs and platelets. So tissue source class, so marami siyang tissue source, the heart, the RBC, the kidneys, the lungs, the pancreas, the spleen, skeletal muscle, liver, and intestine. So the total LDH is usually 140 to 280 U per L. Now, as I mentioned earlier, ang LDH nyo have 5 isoenzymes, LD1, 2, 3, 4, and 5. Take note, class, that the highest isoenzyme is LD2. LD2 is the highest with a percentage of 29 to 39%, while the lowest class is LD5, 6 to 16%. Now, the LD isoenzyme class is made up of 2 subunits. So, 2 subunits, H subunit and the M subunit. So, H subunit will stand for the heart subunit and has a higher affinity for lactate. While the M subunit class is the muscle subunit, has a higher affinity for pyruvate. So let's discuss them one by one. This is a summary class. Si LD1 nyo is made up of 4 subunits of H. So H, 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 H. That's your LD1. Its tissue source are the heart and the RBC, and is related with myocardial infarction and hemolytic anemia. While your LD2 is tissue source is heart and the RBC. Megaloblastic anemia, acute renal infarction, hemolyzed specimen. Then yung LD3, tissue source niya are the lungs, the lymphocyte, the spleen, and the pancreas. Disorder associated is the pulmonary embolism, extensive disorders, pulmonary pneumonia, lymphocytosis, acute pancreatitis, carcinoma, or the cancer of the pancreas. Then LD4, this is usually seen in liver, hepatic injury, or inflammation. Then LD5, usually found in the skeletal muscle, related with skeletal muscle injury. Now, what is the diagnostic significance of LDH? So, higher serum levels of total LDH class, please take note, is usually seen in pernicious anemia and hemolytic disorders. Hepatic CA and toxic hepatitis would show a 10-fold increase in total LDH nyo class. So, if the patient is suffering from liver cancer and toxic hepatitis, there would be a 10-fold increase. Now, the major tissue source of LD5 class is the liver. So, for hepatic cancer and toxic hepatitis, LD5 is abnormally or markedly high. Then we have your viral hepatitis and cirrhosis. LD5 is slightly increased. Now, conditions associated with increased LD level: anemia, pernicious, hemolytic, megaloblastic, myocardial infarction, leukemia, renal infarction, hepatitis and hepatic cancer, malignancy, muscular dystrophy, and pneumonia. Now, in your LDH, we have this so-called flip pattern. As I mentioned earlier, the most abundant isoenzyme for LDH is yung LD2. Lagi siyang mas madami class. In a normal testing, kapag nag-perform ka ng electrophoresis, makikita mo doon that LD2 has the highest band. Siya yung may pinakamataas na band. It's the most abundant. So, in a normal, katulad nito, in a normal ratio of LD1 and LD2 class, LD2 is always higher. higher. But there's this so-called flip pattern. Now, this flip pattern is usually seen in myocardial infarction and hemolytic anemia. Sa flip pattern class, bumaliktad siya. In a flip pattern, it is your LD1 that is higher, greater than 1 siya. So, example, your LD1 here would have a ratio of 1.5, while your LD2 would be 0.75. So normal, di ba? In a normal person, let me repeat, it's LD2 that is higher. But if a person is suffering from myocardial infarction, hemolytic anemia, we have this so-called flip pattern, wherein LD1 would now become higher or greater than LD2. Now, what are the methods for LDH? So, there are two reactions class that I want you to take note. As I mentioned earlier, ang LDH nyo is capable of causing a reversible reaction between lactate and pyruvate. And there are two reactions involved here. We have the forward and the reverse. Kapag forward reaction, it is the conversion of lactate to pyruvate. Kapag naman reverse reaction, baliktad lang class, pyruvate to lactate. Now, both reactions have different pH. Kapag forward reaction, the pH is 8.3 to 8.9. Kapag reverse reaction, 7.1 to 7.4. Kaya if you notice dito sa arrow, makikita nyo dalawang arrow because this is a reversible reaction. Pwedeng forward, pwedeng reverse. Baliktaran sila class. Now take note that in the reverse reaction, the velocity of or rate of reaction is 3 times faster than the forward reaction. So mas mabilis si reverse reaction class kaysa sa forward reaction. Lactate is a more specific substrate than pyruvate. Now, LD1 testing class would refer a forward reaction, while LD5 prefers a reverse reaction. Now, let's talk about the total LD measurement. Now, under total LD measurement, we have the Walker method. Now, the Walker method is based on the forward or direct reaction. It produces a positive rate of NADH, so increase in the absorbance of NAD to NADH, not affected by product inhibition. Then we have your alkaline pH set at a pH of 8.8. So yung Walker method yung set at alkaline pH of 8.8, read at a wavelength of 340 nanometers. Reference value is 100 to 225 U per L. Then we have your Wroblewski-Ladu. So this is Wroblewski-Ladu class is a reverse indirect reaction, 2 times faster than the forward reaction, based on the dry slide technology. Advantage nito class is that it would use a very small amount of sample, read at a wavelength of 340 nanometers. Reference value is 80 to 280 U per L. Then we have your Robluski-Cabot. Robluski-Cabot is a colorimetric method class. Reaction with DNPH at an alkaline pH. Increase in the absorbance. Wavelength, it is read at 440 to 525 nanometer. Shows a visible result. And product is a golden brown phenyl hydrazine. Now, what are the considerations in LDH analysis class? So, take note of this. Yung substance, the substance alpha hydroxybutyrate is another substrate that could be used class. So, alpha hydroxybutyrate could also be used. It represents LD1 activity, elevated when both LD1 and LD2 are increased. RBCs would contain very high LD. Then LD activity in pleural fluids. So let's have a recap in your AUBF. Diba? When we talk about pleural fluid, it's usually associated with transudates and exudates. So you could use LDH to differentiate transudate from an exudate. If it's a transudate, you would have a low level of LDH. If it's an exudate, you would have a higher level of LDH. Now take note, class, that slight LDH would increase after blood transfusion due to minimal RBC lysis. Decreased LDH values are seen in frozen sample. Greatly affected by frozen sample is LD5 isoenzyme. So decrease ang LDH nyo, class, if you freeze the sample. And the isoenzyme, yung pinaka-affected dito is always LD5. Now, let's go to your creatine kinase or your CK. Now, creatine kinase is also known as your ATP, creatine, and phosphotransferase. This is also a small molecule class but not as small as amylase, responsible for the transfer of PO4 group between creatine phosphate and ADP. Storage of high-energy creatine phosphate. So, siya yung storage form of high-energy creatine phosphate. Predominantly, class CK is found in the muscles where it is involved in the storage of creatine phosphate. It's made up of subunits M and B. These are the different monomers of CK. So familiar na kayo sa M and B, di ba? M would stand for muscles, B would stand for brain. So the CK, the major tissue source would include the brain tissue, smooth skeletal muscles, smooth muscles in class, cardiac muscle, bladder, placenta, and the lungs. Now, reference value for the male is 15 to 160 U per L, female 15 to 130 U per L, and CKMB is equal to 6%, less than 6% of total CK. So, let's say, class, ang total CK mo is 100 U per L. If you want to know the CKMB, most likely mag-estimate ka. So, less than 6% daw. So, the 6% of 100 is 6 U per liter. So, ganun siya. If you want to get the CKMB, you get the 6% of the total CK. Now, let's talk about their isoenzymes. So, these are the different isoenzymes class. We have your CKBB, CKMB, and CKMM. Now, CKBB class is also known as your CK1 or the brain type. This is found in the brain. This is the most anodal. So, pag sinabi most anodal, again, this is the fastest. And it is the most heat-labile isoenzyme. So, siya yung fastest. Siya rin yung heat-labile isoenzyme. Now, this is the dominant isoenzyme of CK found in the brain, the bladder, intestines, and smooth muscle. Adult serum rarely contains CKBB of brain origin. Then we have your CKMB. Now, CKMB class is known as CK2 or the heart or the hybrid type. The tissue source is the heart and skeletal muscle. Cardiac tissue would contain significant amount of CKMB. Then, serum CKMB in healthy person is 5 microgram per liter. Elevation is seen in AMI and subarachnoid injury, considered to be a serodiagnostic tool for the diagnosis of AMI and subarachnoid injury. Then we have your CKMM. CKMM is known as your CK3 or skeletal muscle type. Tissue source is the heart and the skeletal muscle. Least anodal class. So siya yung slowest. 94 to 100% of total CK class is CKMM. So ganun siya kadami class. Mostly ang ano mo is CKMM. Then take note class, ang CKMB dito ang isa sa mga pinaka-important, usually seen in acute myocardial infarction and subarachnoid injury. Now, what is the diagnostic significance of CK? So this is a very sensitive marker class for AMI, specifically CKMB. Now, total CK highest elevation is seen in Duchenne's muscular dystrophy. Now, if the CKMB class, take note CKMB of greater than 6% of total CK. Diba ang CKMB nyo kanina sa reference value? It has to be less than 6% ng total CK. Now, if it's greater than 6%, this is a sign that the patient has myocardial damage, particularly AMI. Now, how would you know or what are paano mo ba mamamonitor yung rise ng CKMB mo kapag may acute myocardial infarction? So ito yung pattern niya, class. It has a pattern that wherein it would rise within 4 to 8 hours. So if a patient suffers from acute myocardial infarction, within 4 to 8 hours, magra-rise siya. It would peak as early as 12. Magpipeak yan, class, as early as 12 to 24 hours and would return to normal within 2 to 3 days. So siya yung pinakamagandang marker, class, that you could use if the patient is has suffered from AMI. Now, markedly increased total CK is seen in trauma to skeletal muscle, convulsion, tetany, surgical incision, intramuscular injections, and strenuous exercise. Now, what are the methods for your CK? So we have your Tanzer-Gilbert assay. Now, Tanzer-Gilbert assay is a forward or direct method set at an alkaline pH of 9, wavelength of 340 nanometers. It is a forward reaction, so this is coupled with other enzymes, namely CPK, creatine phosphokinase, and LDH. Since there is a conversion from NADH to NAD, we are measuring the decrease or reduction in absorbance. So si Tanzer-Gilbert assay nyo, class, is a forward assay. Alkaline pH of 9, read at wavelength 340 nanometers. And it uses 3 enzymes, CPK, PK, and LDH. So ito yung reaction niya sa baba, class. Creatine plus ATP would be converted by CPK to creatine phosphate plus ADP. ADP plus phosphoenol pyruvate would be converted to PK by pyruvate and ATP. Pyruvate plus NADH would be converted by LDH into lactate plus NAD. Then we have your Oliver-Rusalki assay or the reverse or indirect method. Now, this is set at an acidic pH of 6.8, read at a wavelength of 340 nanometer. Most methods use the principle of Oliver-Rusalki. So, yung methods class today, ginagamit siya ng principle ni Oliver-Rusalki, reverse and indirect. As there is a conversion of NADP to NADPH, we are measuring the increase in absorbance. So, dito gumagamit din siya ng 3 enzymes class, CPK, hexokinase, and G6PD. So creatine phosphate plus ADP would form creatine plus ATP. Now ATP plus glucose would be converted by hexokinase to ADP plus glucose 6-phosphate. Glucose 6-phosphate plus NADP would be converted by G6PD to 6-phosphogluconate plus NADPH. Now, considerations when it comes to CK class. So, there's a substance known as your adenylate kinase. Now, the adenylate kinase is also known as your AK. AK here class would interfere with your creatinine or your creatine kinase. Released from RBC during lysis, thus hemolyzed samples can cause falsely increased total CK level. Now, creatine kinase would be seen in increase in the following disorder: muscular dystrophy, AMI, hypothyroidism, pulmonary infarction, Ray's syndrome, strenuous exercise, and intramuscular injection, cerebral vascular accident, Rocky Mountain spotted fever, carbon monoxide poisoning. Plasma enzyme activities after AMI class. So we have your CK, AST, and LD. So ito yung arrangement nila class from the first marker to rise. Or ito yung order nila. The order of markers to rise in AMI. So the first to rise would be CK, followed by AST, and the third would be your LDH. Alright, let's continue with your aldolase class. Now, aldolase is another name. It's known as your fructose 1,6-diphosphate aldolase. It basically splits fructose 1,6-diphosphate into two triose phosphate molecules. So, yung fructose 1,6-diphosphate nyo class is being converted into two triose phosphate molecules. Major tissue source is the skeletal muscle, and this is a marker for muscular disease class. So there are three isoenzymes of aldolase class: aldolase A, B, and C. Now, aldolase A isoenzyme is specific for the skeletal muscle. Aldolase B is for the WBC, liver and the kidney, and aldolase C is for the brain tissue. Now let's go to another enzyme class, your 5' prime prime nucleotidase. This is known as your phosphoric monoester hydrolase. This is a marker class for hepatobiliary disease and infiltrative lesions of the liver, used for the differentiation of obstructive from hepatocellular jaundice and hepatobiliary from osseous diseases. So usually class C5' nucleotidase nyo is increase in hepatobiliary. So you could use this in differentiating liver damage from bile duct or gallbladder injury. Then the method would be used here is the Dixon and Purdon, Campbell and Belfield and Goldberg. Substrate use is your 5' AMP. AMP class stands for adenosine monophosphate. Inhibitors would include nickel ions and concanavalin A, which is a protein. Reference value class of your 5' nucleotidase is 0 to 1.6. Increase in post-hepatic jaundice, intrahepatic cholestasis, infiltrative lesions of the liver, and hepatocellular jaundice. Now let's go to another important enzyme class, your GGT, your gamma glutamyl transferase. So this is responsible for the transfer of glutamyl groups between peptide or amino acids through linkages at a gamma carboxyl group. Normally found at the canaliculi of the hepatic cell, epithelial cells lining the biliary duct, the kidney, the prostate, and even the pancreas class. Increased levels in individuals undergoing warfarin treatment, phenobarbital, and phenytoin therapies. Substrate use class is gamma-glutamyl para-nitroanilide. The methods used are SAS, Rosalki and Taro, and Orlowski. Reference value for the female is 5 to 30 UL. Male is 6 to 45 UL. Now, the diagnostic significance of GGT class is that it is elevated in all hepatobiliary disorder. This is a sensitive indicator class of alcoholism. So if a person, one way you want to identify if a person is alcoholic class, they tend to have high GGT. So let's say if you want to know why the cause of liver cirrhosis, let's say you want to know if the cause of liver cirrhosis is due to alcoholism, due to alcohol, or non-alcohol. So if it's alcohol caused by alcohol class, it usually has an increased ALT, increase GGT. But if it's non-alcohol class, most of the time it's only ALT. Katulad nga ng mga kanina, yung hepatitis viruses, di ba? Mataas siya sa mga acute cases of liver disease or acute hepatitis. So this is a sensitive marker for acute alcoholic hepatitis, monitoring the effects of abstention from alcohol. So sa ibang bansa class, and even here in the country, may mga rehab tayo for alcoholics. So one way they would monitor if the person is still abstaining, yung tinatawag nilang sober. Pag sinabi mong sober, nag-abstain ka sa alcohol. Like let's say, 1 year ka nang sober, 1 year ka nang hindi umiinom ng alcohol. So they would know if suddenly 1 year ka nang mababa yung GGT mo, then all of a sudden biglang taas. So there's a possibility na nag-relapse ka back to alcoholism. So bumalik ka na sa pagiging alcoholic mo. So that's the importance of GGT. Elevated in whole hepatobiliary disorder and a very sensitive marker for alcoholic hepatitis or cirrhosis. Then let's have your pseudocholinesterase class. So this is related to acetylcholinesterase. Now from the prefix pseudo, meaning false, hindi talaga siya yung cholinesterase. So pseudocholinesterase class reflects synthetic function of the liver. So more on the liver siya class. It catalyzes the removal of benzyl groups from cocaine and is a marker for insecticide, pesticide poisoning. So usually decrease ang pseudocholinesterase mo class kapag you are exposed to pesticide or insecticide poisoning. Monitoring the effects of muscle relaxants after surgery. Involved in the metabolism of anticholinergic drugs. Tissue source is the liver, the myocardium, the pancreas. Decreased level would be the acute hepatitis, cirrhosis, carcinoma, metastatic to the liver, and malnutrition. Method used class is the Ellman technique and the potentiometric. Reference value is 0.5 to 1.3 pH units in the plasma. Now, take note class is that your pseudocholinesterase would reflect acute toxicity of insecticide and pesticide, while si acetylcholinesterase nyo would reflect chronic exposure. Then we have your angiotensin converting enzyme or the ACE. So this is a member of hydrolase classification class, also known as your peptidyl dipeptidase A or the kinase 2. Familiar kayo dito class sa angiotensin 2 if naalala nyo sa AUBF niya. So it converts angiotensin 1 to angiotensin 2 in the lungs, yung RAAS if na-remember nyo sa AUBF niya. Possible indicator for neuronal dysfunction. So kung may problem ka sa utak class, specifically may Alzheimer's disease ka, you would have elevated angiotensin converting enzyme. Critical target for inhibitory drugs designed to lower blood pressure. This is an angiotensin blocker. So this could be used to monitor class why you have low blood pressure. Then the substrate here class is the benzoyl glycyl histidyl leucine. Sources class are lungs, the testes, the brain, which is a possible indicator of neuronal dysfunction. Increase in liver disease, active sarcoidosis, leprosy, and even Gaucher's disease. Normal, usually seen in inactive tuberculosis class. When you say inactive, this is the latent TB and other granulomatous diseases. Then we have your G6PD class. Now, G6PD class is part of newborn screening. Very important to class in your RBC structure. Now it maintains NADH in the reduced form in the RBC. Tissue source is the adrenal cortex, the spleen, the RBC, and the lymph nodes. Now, enzyme deficiency class can lead to drug-induced hemolytic anemia after taking primaquine. Si primaquine kasi class, one effect of primaquine is that it could weaken the structure of their RBC. Diba ang mga primaquine, itinitake mo yan if you have a malarial or a malaria infection. So if you take that class, it weakens the structure of RBC, making it more easily destroyed. And that could lead to a type of anemia known as hemolytic anemia or drug-induced hemolytic anemia. Now, increase AMI and megaloblastic anemia. So increase siya class in acute myocardial infarction and megaloblastic anemia. Reference value of your G6PD is 10 to 15 units per gram hemoglobin or 1200 to 2000 MU per ml of PAC RBC. Now, what are the G6PD assays? So we have your ascorbate cyanide test. Blood is incubated with sodium cyanide and sodium ascorbate. Generation of hydrogen peroxide from the coupled oxidation of ascorbate and hemoglobin. Cyanide would be the catalase inhibitor. Hydrogen peroxide oxidizes hemoglobin, which leads to a brown color of met hemoglobin class. Decrease of color is proportional to the level, take note of that class, decrease of color is proportional to the level of G6PD. Then you have your fluorescent spot test. This is for newborn screening, a very sensitive screening test. Specimen is whole blood. Reagents used are your glucose 6-phosphate, NADP, saponin, buffer. If G6PD class is present, NADP is converted to NADH. NADPH would fluoresce but not NADP. Sources of error would include phosphokinase deficiency and unstable hemoglobin. Other enzymes class that you should take note of are ceruloplasmin. This is a copper-carrying protein or a copper-carrying protein. Marker for Wilson's disease, accumulation of copper in the liver. So dito yung tinatawag nila class na Kaiser-Fleischer rings. So these are usually seen in the eyes class wherein there would be the presence of copper in the eyes. Yung Kaiser-Fleischer rings na yan. Then we have your ornithine carbamoyl transferase or the OCT. This is a hepatobiliary disease marker found exclusively in the liver. So that basically ends the lesson 1 enzymes class. These are the references. Thank you.